Hello, I'm Dr. Brian McDonough. Today I want to talk about an important topic, that is mammograms and the relationship to the COVID vaccine. Now, I just mentioned I wasn't going to be talking that much about COVID unless it came up, and I was going to talk about other topics. Well, here's a case where the two topics actually get together. Mammography is very important for women as they get older, especially to find out if they have conditions associated with breast cancer. Lumps that might be too small to detect can actually be found in a mammogram. And certainly as a screening tool, mammography has been shown to save lives. But now there is information that you shouldn't get a mammogram at least 4 weeks after you get your COVID vaccine. Why? Very interesting. The COVID vaccine works like all vaccines. It fools the body into thinking that you have the virus. So the body is fooled into thinking you have COVID. And because it's fooled into thinking you have COVID, different things can happen. You might get fever, chills, muscle aches, a lot of those symptoms. But one of the things you can get is lymph nodes. Little bumps, like those little bumps you might have under your arm or your groin in different areas. Lymph nodes drain away infection. Even when there's no infection and you're faked, you can actually be faked into having lymph nodes. So here's the concern. They found that a certain percentage of women might get a lymph node under their arm in the axilla. That can fool a mammogram. In other words, it's seen as something that is risky, and that would lead doctors into thinking they should do more procedures, maybe a biopsy, more follow-up studies. So what the researchers are saying, and the scientists and doctors are now confirming, is if you get the COVID vaccine, there's no need to get the screening mammogram that you could get almost any time to get it in that 4-week period. Now, very important, if you were already told to get a mammogram for a diagnostic reason, something they're concerned about, definitely talk to your doctor because that's different. A screening versus a diagnostic study has a different level of importance as far as how quickly you want to get it. So again, if you're going to get the COVID vaccine, you can always reschedule your mammogram. I would talk with your doctor about it and make sure your doctor is on board. And if it's a test that's necessary for you to have because they're concerned about something, you may not want to put off the vaccine or put off the mammogram. But once again, that's where communication is great. Talk with your physician about it. But it's an interesting thing that most people would not have thought about. It's only something we're learning as we give out the vaccines and we treat people and we see these things and just basically figure out the science.